Representative Meeks, and then Hammer, and then we're moving on, I think.
Thank you, Mr. Chair. Senator Bledsoe kind of jogged some questions, a couple of questions. She mentioned the fact that Medicaid is going to be contracting, but it's my understanding that private option is under DHS, considered under DHS. Is that correct?
The funding will come through us.
Are you anticipating? We know the guide that they're going to be contracted. So I guess technically they're not going to be state employees. You're not going to be adding anybody necessarily to the state employee role because of that.
The guys will actually be insurance through the contractors by the insurance firm. We don't have any role with them other than some will work through our offices.
Do you have any anticipation of having to add employees due to the private option under DHS? What about the insurance department?
Because of the private option.
Because of the private option, are you having to expand your workforce or enrollment or anything? We know the guides.
The only thing I would say is we are adding one contract monitor.
So we're basically
going
to sign up 330,000 extra folks, 250,000 from the 1 to 138 to 80,000 from this 18 to not 100%. And I'm here to understand that we're not going to have to add any employees whatsoever other than the guides, which technically are not state employees in any department.
Pretty impressive, isn't it?
I hate to tell you, we've had to figure out how we can do that in other areas,
We have spent the past few years in DHS automating our systems, and luckily the work we've done and what we continue to do, we believe puts us in a position to be able to handle the workload.
I
have two caveats that I think is important. You pass legislation that brings the federally facilitated exchange back to a state-based exchange. So I don't know, Cindi, if there have been personnel projections for a state-based exchange.
When you say state-based, you're talking about the nonprofit model, correct?
The second part of that was to outsource it in a nonprofit model. But for a period of time, there will be a parallel process, and there will be some redundancy. So I just don't want to get anybody saying there will never be one person extra hired while we have a redundant process to get to a nonprofit.
Yeah, we haven't hired all the people on the state partnership yet, so that's why we are hiring somebody else at the insurance department, but not because of private option.
How many?
We're looking at another 6 or 7 to be hired to get us through this implementation.
So it seems basically at this point the big surge is the 600-something guys, navigators, and everything else of that nature. They're supposed to either go away or lessen as we get everybody enrolled and as we get the system working like we hope it will be.
And then the insurance companies will have many more consumers on their rolls as well.
Right. You're outsourcing the administrative costs.
Pretty much to the
plans. But, Representative Meeks, I was joking, but I would absolutely encourage you and everybody else returning here to hold the department and everybody at the end of the table accountable because, I stood in the well of the House and said that it was projected to be a 35% reduction in Medicaid enrollment. I think by year 3, and with that comes reductions in staff and administrative cost and size through attrition or other things. Maybe not necessarily firings, but or letting people go, but instead of a line that's constantly growing, it should be a line that's flattening and slowly diminishing. And everybody needs to remember that and hold them accountable for it.
And last one question.
Yeah, there's a lot of hundreds of millions of dollars in contracts inside the department that I think might be duplicated at a certain point. So lots of rooms for savings and reductions in traditional management and operations.
Okay. And then last question. This is kind of separate from everything else. Is there a plan B if one of the triggers are done? Are we planning on if we don't get the waivers like we think that we are as we go forward? Because just to give you an example, Paul Ryan basically said, look, we're up against the debt ceiling. There's already been a lot of discussion in Congress about the match rate for the federal poverty level being in the mix as to how they negotiate, which is one of the triggers. Are we anticipating what we're going to do if something happens and we don't get the private option?
Plan B under the private option is that it stops. I mean, you all could make a decision along with the governor to continue it, but Plan B is people would not have coverage. We either wouldn't start it if something changed between now and when we start, or we would stop it within, I believe, 120 days is what the law says. If there's change and so on, consistent.
Right, I understand that, but I understand we stop it. But 100 to 138 would still be eligible for subsidies on the health insurance. Are we basically so that we can still get those signed up underneath
So
the health insurance exchange, and then maybe coming up with a plan, okay, well, what can we do with the 18 to 100%? So they're not just kind of left out there.
So let's be clear what it is. The federally facilitated state-based exchange under congressional law is going forward, no matter what we do.
Correct.
The private option, which you have authorized DHS to implement, only goes forward if we get the waiver under the restrictions that you asked for. Should that not happen, Director Cindi is correct, the private option either doesn't ever get started or stops. Those between 100 and 138% would be still reached by the guides, and for those that chose to go on to the exchange, be able to get insurance. Those below 100% would have no option under any plan currently under development in the state of Arkansas.
All right, so then the question goes to you, Ms. Crone. Are you guys preparing to be able to absorb that 100 to 138? Do you have a plan in place? And if the private option goes away, you'll be able to sign up the 100 to 138 under the federal subsidies?
It would happen by default.
But you do have a plan, a plan in place.
It would be the same process that we use now.
Okay, so there'll be no different process from the 100 than what you're doing with the 138 to 400%.
And let me. I think this is where we're still splitting in what you have done and we're trying to make happen is putting it together. The guides are going to go out and encourage somebody to go to the magic box in the sky that assesses their citizenship and their income. If they're above 138%, they go to the shopping experience if the private option is in place. If the private option isn't in place, if they're above 100%, they go to the shopping experience. If the private option is in place and they get kicked out of, when I say magic box in the sky, it's the
Federal hub.
The federal hub. If they're below 138, they're coming to Medicaid for Arkansas shopping experience. If the private option doesn't go forward, there's no Arkansas shopping experience.
Okay.
And that's why it is redundant, because if the private option fails, the federal hub is still in place and the shopping experience goes forward.
Is there any talk about what to do with the 18 to 100% if, in fact, the private option goes away?
To my knowledge,
It would be a huge problem.
To my knowledge, there's been no discussion whatsoever other than they would not have an option.
And they would have a responsibility to be covered.
I would like to encourage folks to come up with a plan B for the 18 to 100%. I know that you have a lot on your plate with just going forward and doing what you're doing, and that may be something else as legislators maybe we need to discuss. But we need to be, I want to be prepared for all options just in case. That's my opinion.
I'm confident in Plan A. I mean, I think Plan B is pretty simple. I mean, it's not a bad point, but it's just pretty simple. It was the default position that would have happened. Otherwise, there's really nothing we need to do to prepare, and especially going in with that policy session not being for another 20 months, 19 months. There's nothing that we can do in the short term regardless, but I'd be happy to discuss it with you further if you like.